What can you do with 5 kwacha? Not a lot. A 5 kwacha Auto Boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I'm from Moto. Kairi hospital check. It's a 5 problem. 296 cash. Ngasanya kwa chat. Wametumira kwa 2 Kairi manda kusongera tukara mukurazichi yako datawole bomba. Alipira kwa nabana ku masuku. Walipigwa wale bombenchi tulisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
Hello and welcome to this very exciting conversation sponsored by IO, a subsidiary of MTN. It's an insurance company that offers you, insurance services, particularly for your health cover. If you're looking for an easy-to-use health cover, for example, you foresee or you're involved in an accident, what IO does is that they're able to pay or release cash to yourself or to your family when you're under those circumstances. So dial that number star 629 hash and follow the prompts and register. The way you pay for these premiums is actually very, very easy, because what IO has done is that every time you recharge your phone or you send money to somebody, a portion of that money goes towards your premiums. And should you find yourself in unforeseen circumstances, all you have to do is contact them and they will, do the payout. And a lot of people are benefiting. That's the value of micro insurance, bringing insurance on your doorsteps through your phone. And like we keep saying. Now, do tell us where you're watching us from. Today, like I promised you, I am not alone. I have a guest with me, and today we are discussing issues related to disorders of the menstrual cycle, brought to you by MTN through its subsidiary IO, which is a medical insurance system, a medical insurance company that offers you insurance for various services. So dial star 296 hash to get the details. Now let's get into the subject of the matter. A lot of women have different or varying issues with regards to their menstrual cycles. Now, every woman goes through menstrual cycles, and those menstrual cycles, sometimes they do land into some challenges, some problems may arise. And so tonight, we are exploring that particular issue. And I have a guest with me tonight to help me discuss this subject extensively. Now, I'm hoping that the men are here so that they can hear for themselves, so that they can provide the much needed support for their spouses should such matter. So without much ado, my guest for tonight, my guest is none other than Dr. Tinta Muyuni. Dr. Muyuni, you've been on this platform before. This is not your first time with us. So for people who may have met you before, please go ahead and introduce yourself quickly. So Dr. Muyuni, who is Dr. Muyuni? Tell us.
Good evening, everyone. It's a pleasure, and thank you, Doctor, for having me as a guest on your program. I look forward to positively contributing and updating our women and men out there, and as well as our young people on menstrual disorders.
Right. So very quickly, we are discussing the issue of menstrual disorders.
Mm-hmm.
What are menstrual disorders?
Basically, menstrual disorders are disorders surrounding menstruation. What is menstruation? Menstruation basically is having a period. Once the girl becomes of age, basically between the age of 10 to 16 years, a bit earlier in some of our girls here in Africa. Once we start having a monthly period or a monthly bleed from our private areas there, that is termed as a period. Now, a period simply means the body prepared itself. The lining inside the uterus became thick, waiting for a pregnancy to happen. And that bleeding simply means a pregnancy has not happened. And that is an external sign then that a pregnancy has not taken place. And the lining that the body had prepared to receive that pregnancy is then cast aside, and the body prepares itself once more in the next month when the next egg is released, or the next ovulation happens, that the similar pattern occurs. So the menstrual disorders include a spectrum of issues. It's actually a very big topic, but we'll try and keep it simple and short so that you can understand. Things like abnormal bleeding, because we have to look at everything surrounding that period coming out of a woman's body. Is it very heavy, abnormal bleeding, or excessive? Is it too long? Is it not happening at all? Or perhaps it's happening very irregularly, because it's ideally supposed to be every month or so. It may be excessively light, or indeed very painful as the period comes out, or we may have what people are very familiar with when they have disagreements and they accuse our ladies of having PMS or premenstrual syndrome. And I think we'll go into each one of these disorders. So any disorder surrounding the menstrual period itself, how it happens, how long it happens, that affects your quality of life, that makes you unable to execute your functions normally in your everyday life. Anything in that bracket will label as menstrual disorders. And it's actually the most common cause why women come to visit us as gynecologists in the outpatient department.
Right. So, Dr. Muni, being a gynecologist, let's go through this thing step by step. I'll start you from a point of amenorrhea. A woman is not seeing her periods, because that's one of the commonest problems that we encounter. So what are the issues around there? What should be going on in the mind of a woman, or indeed a man, when the woman is not seeing her periods? What are the issues?
Okay, so amenorrhea, let's familiarize ourselves with the medical terms. Amenorrhea just means no period. So when your doctor says primary or secondary amenorrhea, we want you to understand that this is simply lack of period. There's a saying that every woman is pregnant until proven otherwise. So when women come into the hospitals, frequently they are subjected to pregnancy tests and so on, because until proven otherwise, we assume that someone is pregnant. Number one cause of lack of a period is pregnancy. So let's start with primary amenorrhea. I did mention an age range, say from about 9, 10 to 16 years. We expect a girl to have achieved secondary sexual characteristics, that is growth of underarm hair, growth of curly pubic hair or coarse pubic hair, development of breast buds on the chest, and her curvature changes to adopt that of a woman. Having these characteristics, and then once ovulation happens, about a year or so after these characteristics come up, we expect that someone will start seeing a monthly period. But in some cases, it doesn't happen. So primary amenorrhea, someone has never had a period to start with, never ever had a period. So we look at the causes. One could be the signals from the brain that signal to the ovaries and the uterus, because a woman's menstrual cycle is guided by the pituitary and the hypothalamus in the brain. These are glands that control the menstrual cycle. Then in the abdomen, there's the uterus and the ovaries that play a role together to form a period. So if at any of these levels development has not occurred, including the passage, the exit, where this blood is supposed to come from, then a period may not occur at all. So commonly, could this be a genetic disorder? I think even on one of your previous programs, you have looked at disorders like intersex, where someone may have external features of a female but may have a male gonads or things like that. We have looked at some other genetic abnormalities where the uterus, the ovaries did not develop at all.
Yes.
It may be that your uterus and ovaries are there, but the passage is not well formed. And in such an individual, they may have a period, but it has no exit. As such, a girl may have severe pain, but on a monthly basis, but no bleeding. But that particular one is correctable. We call it cryptomenorrhea, but it's also under the categories of primary amenorrhea, where a girl has never had periods before. So when we go to the hospital, we want to test the hormones. Are the ovaries producing their portion? Are the pituitary and the hypothalamus doing their part? And we can do a scan to see if your anatomy or if your organs are all there and they are in normal structure. So that is for primary amenorrhea, or period that has never come before. What about secondary amenorrhea? Secondary amenorrhea is where a period has happened before, but for 3 months or more has stopped. Number one suspect is pregnancy. If it's not a pregnancy, again, we look at our usual suspects, the hypothalamus and pituitary. Could they be, overproducing or underproducing hormones that regulate the periods? Is the ovary, is there a cyst or something that is acting like a remote control to the uterus and causing a disturbance? In conditions like polycystic ovarian syndrome, for example, where the ovaries have multiple cysts and the female hormones are on the lower side, whereas the male hormones are on the higher side, characterized by obesity, hirsutism, and acne. Acne is also a sign of some hormonal imbalances. So if a woman has had hirsutism is excessive.
What is hirsutism?
Hirsutism is excessive hair growth, like excessive mustache or beard hair that some women may have. Yes. Okay. Now, it's in extremes. Some women have these conditions, but it doesn't affect them in any way. They have their regular monthly cycles. But some people have this menstrual disorder and it needs looking into, and it can be corrected. Because one of the most important things as well when we are looking at these menstrual disorders is it also affects us as women in terms of planning. How do we plan our pregnancies, for example? When is my fertile period? So it's very important that if someone has irregular period or absence of a period, they get the information and they get the information right. Is this my normal, or is this actually something that needs correction? So for secondary amenorrhea, if you've missed a period for more than 3 months after you've already had, especially in the younger women, In the older women,
Yes.
it may be that your biological clock has reached the logical end and you have reached what we call menopause. That may be in the age range 45, which is a bit earlier, 45 to 55, somewhere there. And then you stop having menstrual periods altogether.
Right. Doctor, let's tackle another menstrual disorder here, pain.
Mm-hmm.
Sometimes
Okay.
these periods can be extremely painful.
Yes.
Dysmenorrhea. What are the issues there? What are the causes? And okay, in any case, we hear periods are painful. I've never experienced a period in my life, but we hear that periods are painful, except that sometimes they can be extremely, extremely painful that they need treatment, which is called dysmenorrhea. What are the issues there?
So dysmenorrhea is a very challenging thing because, as you know, doctor, that as women, we are expected to play on a level playing field. But I think it is recognized. That's why women are granted a Mother's Day to have a break for those who are working, for example, those who are in school. When they have severe pain, they can be away or take time in case of such disorders. Now, the cause of the pain is that shedding of the lining of the uterus. Because the pregnancy has not happened and the uterus now feels it has to shed its contents, it cramps to shed that lining. And there are some chemicals that are also produced, inflammatory materials or prostaglandins that are released. Those women with higher levels of prostaglandins have more severe period pains. And frequently you'll find that if, for example, your mother had similar problem, or in your family the women have similar problem, then it's more likely to be seen in that case. So it can be quite crippling. Some women even vomit from the pain. Some people even pass out. We have stimulation of the vagus nerve of the cervix as well. Even as these clots are being passed out, if you are bleeding heavily and you are passing big clots, there's vagal stimulation that may cause breathlessness, a feeling of passing out, nausea, and just inability. Some people talk of severe backache. So now that we know what is the cause, the cramping, indeed the medication or the treatment involves solving the pain of the cramping. Take antiprostaglandins, for example, ibuprofen or brufen.
Yes.
Those who are asthmatic, of course, sometimes you have to proceed with caution, even simple paracetamol. But some women are not keen on taking medication. A hot water bottle applied to the lower abdomen will ease the discomfort. But if you have a very busy lifestyle, there's no need to wait until the pain is so severe that you are incapacitated or you are unable to do your business. If you know you have severe pains and you feel it coming on, take something so that you are able to continue on your day-to-day activity. So the main cause of this pain is cramping, passing clots, release of chemicals called prostaglandins and other inflammatory agents. And the management is usually anti-inflammatory drugs like brufen and things that inhibit prostaglandin and activity like mefenamic acid, or even drugs like Buscopan, which helps minimize cramping. But all of these are to be taken with guidance from a medical person because they may not be suitable for you as an individual.
Right. Now, when it comes to issues of dysmenorrhea, sometimes you'll find that in us men, we sometimes feel like women are faking it. Is it that some women do fake these things? do some women actually exaggerate the pain?
Well, there are always extremes, but I guess I would put it down to this. You'd have to go through it to you'd
Because
have
I'm
to
a
go
man,
through
doc,
it to
and
understand.
I can never experience a period as a man. So
Yes.
tell us from your perspective, do some
From
women
my
fake this
perspective,
dysmenorrhea or it's actually real?
any condition can be faked, but I think that our women should be given all due respect during that time of the month, and be treated with empathy and concern, and given all the support, because
Right.
what we need to do, especially during that period, one is take a lot of water to help you feel better, to minimize even the feelings of bloating and so on. We don't need to be stressed during that period. The higher your stress levels, the worse your symptoms are. Because stress also comes with release of cortisol, which triggers a lot of other hormonal chains within the body. So we need the support, we need the understanding. People, this can be quite crippling. So it's unfortunate when sometimes the very people we are close to, the very people we are leaning for support, feel it is something to be taken lightly. But I believe that even when you are having any pain or disorders, because it's frustrating to want to go out and you are bleeding too heavily. It's frustrating to be in such severe pain that can be severe at 8 o'clock, and by midday it's very much minimized. So one would want all the support to get through these symptoms, as opposed to being disbelieved. But of course, there are people who fake, and the question would be, why would anyone fake? But at the end of the day, any illness can be faked, but because it can be faked doesn't mean we shouldn't be taken seriously when we have those monthly challenges.
Excellent. So, Dr. Muyuni, I deliberately asked you that question because I know that we encouraged men to be part of this conversation. Because
Correct.
as men, we actually need to know these things, and that we need to realize that as men, we are actually part of the solution. So when your partner is going through a very discomforting period, or they're experiencing excruciating pain, because pain is very difficult to communicate to the next person.
Correct.
Because how can I perceive pain that I'm not feeling? So as
And
men
then
who
the
are on
other
this
thing,
platform,
the other
yes,
thing
doctor.
is, the other thing is that I think even from a traditional aspect, women are kind of given the impression that it's not okay to verbalize your pain because it's a sign of weakness. It's a sign of weakness to seek help, because that is womanhood. Womanhood is characterized by pain of different sorts. And some people feel even taking a painkiller during the periods may affect their fertility. There are all sorts of misconceptions. But I would like, to encourage our women out there, you shouldn't suffer. It shouldn't be like that. We should be as functional as we want to be as women without being limited by normal biological processes.
Excellent. So, Doc, let's go to the next issue with regards to disorders of the menstrual period. We began by discussing the issue of periods not coming, which was
Yes.
amenorrhea. We've just finished looking into the issues of pain, the fact that the pain can be a disorder in itself. Now, let's look
Yes.
to the other extreme, the issue of bleeding excessively and for too long. Now, as you talk about, walk us through, when a woman is bleeding, what is considered the normal amount to bleed during the period? And when you talk about prolonged period, how many days should a period last? So let's discuss this issue of excessive bleeding. Doctor, your comments.
Okay. So first and foremost, I would like women out there and our men and our youths to understand that we are all on a spectrum of normal. Because my period is not 5 days doesn't mean I'm abnormal. So I think everybody ought to introspect, look at yourself and find, where am I on the range of normal? What is normal for me? Now, typically, a period is supposed to come about every 28 days. It may be every 30, 35, as long as there's some regularity in the timing that a period presents itself. Every 28 days or so, it's supposed to last about 5 to 7 days, and it's not supposed to be excessive. For example, a woman loses about not more than 30 mils of blood during the period typically, but some will bleed heavily. Now, how do I know I'm on the heavy end? One, if your period is lasting longer than 7 days, we are talking 10 to 14, some even bleed even a month, that is not normal. If every time your period is round about 8 days and that has been your practice, that is a borderline case. If the period you put on your sanitary pad and within 1 hour it is completely soaked, you change, within 1 hour it is completely soaked, that is too heavy. You have to seek guidance on that one, because you may end up with anemia because of heavy blood loss. And mind you, even as students, as career women, as housewives, our attention is normally on the home, our attention is normally on our work, on our school. We may not supplement ourselves with enough to build what we have lost during the period. So this one I want to emphasize, because before we even become symptomatic for anemia, if our periods are heavy, we need to counteract the loss that we have. We need to build up what we lost, so that if my hemoglobin level, or my blood level, to put it lightly, was 10 during this period, then after my period it comes to 9. If my diet does not push me back to 10, next period I'll be at 8. So we need to pay attention. It doesn't hurt also to just take some iron supplements during the period and the week after that, just to return what you had lost. So we are looking at what is heavy. What can I say is heavy? Because some people have heavy periods from the word go, so they have never known any different. But if you are soaking a pad in 1 hour, next hour you are soaking a pad completely, that's too heavy. You need to come to be seen so that we can see what is causing that. Is it that you have a bleeding disorder? Is it that you have fibroids? Is it that perhaps you have just some other growths like polyps within the uterus? Or you just have a constitutionally heavy bleed, or just a normal heavy bleed? What is the cause? Is there any infection causing inflammation or heavier bleeding? Are you on a loop? People with loops tend to bleed heavier, but that doesn't mean the loop is bad. You just have to know how to manage yourself and your loop. So what we want you to remain as is a functional, productive woman. Your period shouldn't make you anemic. So if you qualify in that group I've talked about heavy periods, some people use baby diapers to just be able to get from point A to point B. Some people, when their period comes, they are grounded. They cannot move because any movement, they have messed themselves up. So that's in the range of heaviness. With regards to the duration, if it's longer than 7 days, I think whether it's light or not, because some women may have a period of 3 days, but that same 3 days is so heavy that they are left anemic. Some people may have a lighter period, but because it takes 10 days or so to finish, they are still left with a deficit. So we look at the duration, the amount of the bleeding, and see if it is resulting in you being anemic or it is disturbing your program too much, then it's time for intervention.
I see. So, doctor, we are about to discuss the next disorder with regards to periods, which is premenstrual and postmenstrual syndromes and issues of the psyche and the periods. But before we do that, let's just take a quick word from our sponsors, and then after that, we'll also, be taking questions after discussing the last segment.
What can you do with 5 kwacha? Not a lot. A 5 kwacha Auto Boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. Why Mponkela na moto? Kaeni ko hospital check. It's a 5 problem. 296 cash. Ngasanya kwa chat. Wamitumira ko 2 pills. Kayo manda kusongera tukara mukula zichi yako datawole bomba. Alipira kwa nabana kuma school. Wale bomben tulisuma sana.
Dial *296# to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
Welcome back, and thanks to IO for sponsoring this very exciting program, and thanks to IO for bringing us Dr. Muyuni here. And if you have just joined us, we are discussing menstrual disorders. And if you've just joined, Dr. Muyuni began by telling us what a normal period is and how many days it should last. She went on to tell us about amenorrhea, where you are not seeing your periods and what are the causes. Then she spoke about dysmenorrhea, which is excessive pain during your periods. And for the men out there, she emphasized our job is to support our women and that they are not faking the pain. The pain is real and that's excruciating. She went on, before we took a break, to talk about menorrhagia, which is excessive bleeding. Now, we are talking about the psychology of a period, which is PMS, premenstrual syndrome or post-menstrual syndrome. Dr. Muyuni, walk us through these things. Are these things real?
These things are very real, and because they are characterized anyway by physical and emotional changes prior and perhaps a little after the period. What are some of these physical changes? Breast tenderness or breast fullness or pain. When you touch your breast, it feels very painful. Sometimes you feel bloated. You feel like you are bursting out of your body. You just feel generally uncomfortable. Eating is uncomfortable. Lying down is uncomfortable. And one of the biggest things is moodiness. Moodiness and feeling very vulnerable, crying easily during this time. And as such, as partners, husbands, brothers, it takes understanding. I think if we know each other's cycles pretty much, there's no need to take so much offense if someone cries easily or mock them if they are emotional, because some of these things are actually cyclic, they are hormonal related. But in some cases, they can be quite severe. They can be quite severe, causing disruption, causing fights, causing just standstill within the home, the mood swings, the anger, lashing out towards each other and so on during this time. So if one has these, there are ways of managing them, not only medical, but even changes in our behavior, even ourselves as women. I don't think it's good enough to just say it's my hormones, but you must understand at the time that you are going through this, that what you are going through also has impact on others. As such, with this understanding, we also have to give ourselves some changes in our behavior, our interaction, avoiding provocation. Sometimes you may avoid interaction, or you want some solitude during this time, because you know that when people come into your space, you may lash out. There's a whole lot of things that can be done, including some antipsychotic therapies. But simple things like reducing salt, caffeine, sugar does improve your mood, and the famous drinking water. All these actually do improve your PMS, your premenstrual symptoms. Other things that can be done, medication, like moderating your hormone levels, suppressing them in a way, maybe with like the family planning pills will suppress your mood, or your emotional status. Some people, there are other surgical things that can be done, but we'll leave that out unless in severe cases. For now, we look at dietary changes, some medical treatment, and cognitive behavior. Cognitive behavior, like I said, it simply means you know what is your situation, you are aware of the time of the month that it is, and I know that this time I may not want to interact too much with people because my temper is on the higher side, or I'm going to keep myself busy. I'm going to do more activities that will distract me from my emotional state. There's a whole therapy, a lot of things that can be done. Some people even swing into depression during this time, and I believe there was a show done about depression. It has, different levels of clinical presentation, from mild to severe, but it's all an issue of understanding your situation, understanding yourself, and doing what needs to be done, again, to allow you to be functional and be able to interact well in society.
So, Doctor, thank you very much. Now let's open for questions. I know people have been itching to ask questions. So for you who've been with us up to this point, following this very interesting conversation, it is your chance to ask questions. So go
Doctor,
ahead.
I just wanted to add one more thing.
Yes, go on, Doctor, before we take the
I
question.
just wanted to add one more thing. Also, for the abnormal bleeding, you may notice bleeding a bit more frequency, or mid-cycle bleeding. Some people may have bleeding after intimacy. That is also in the range of disorders, because you are bleeding when you are not supposed to be bleeding. And then when we are looking at these disorders, of course, the treatment is not uniform, it's individual. It comes from your doctor asking you specific questions about your lifestyle, about the frequency. Are you on any specific medication? Don't leave out medications, because some of these medications predispose you to bleeding. Especially, for example, after this COVID period, a lot of people were on blood thinners because of being COVID infected and have had subsequent heavy bleeding in other periods. Bring out all the information that you can. Have you had operations before surrounding your uterus, your ovaries, and so on? How is your diet? How is your exercise plan? Have you lost weight? Have you gained too much weight? Are you likely to be pregnant? All these things are important to discuss with your doctors, as they may be contributing.
Right. So our first question, Doctor, comes from Sandwell Abigail Jana Michael. Her question is, what causes some people to delay reaching their menopause? And let me add to her question, is delayed menopause a disorder?
Okay, so when we are looking at delayed menopause, again, if you recall, I had discussed that menopause may occur anytime between the age of 45 and likely 55. Start with asking the women in your family what ages have they had their menopause. It may be that the women in your family just reached the menopause late. Two, are you comparing yourselves to other women of your age who have already reached menopause? Because some people reach at 50 or 49, and you might be, about 53 and you are still going, but you are still within the normal range. Other people start their periods late, and this is actually one of the most common contributing factors. They start their periods late, and as such, they may finish also late because they are then winding up their reserve of eggs and so on at a later stage. So these are some of the questions I would want to ask. Most likely it is familial, and it may be to do with the time when you started your periods. But it's worthwhile going for a checkup, because if the bleeding is still going on after 50, 53, 55, somewhere there, you just want to check in and see everything is normal. There's no harm in waiting until the normal has happened. But if there's any suspicion, there are tests that can be done on the lining of the uterus to quickly diagnose. Because as you know, the older we get, the more predisposed we are to these cancers and so on.
Next question, doctor. The question to you is this. This is from Dina or Diana Nyerenda. Her question is, Doc, is it true that childbirth reduces the pain with regards to dysmenorrhea? So if somebody got pregnant, would it help with dysmenorrhea?
Apparently, it does. Some studies have shown that childbirth does reduce. It reduces, remember, I said of the chemicals that are responsible for pain, childbirth reduces the prostaglandin receptors, apparently. And also, the cervix, the opening of the mouth of the uterus, is slightly more open after you have given birth. As such, the blood flows a bit more readily, as opposed to the smaller pinhole opening that is there before you have given birth. So it does help, but it's not in everybody.
Right. There's this other question here. I think the questions we are getting are very interesting. And what I like about them is that they are sticking to the subject. I want to thank you for sticking to the subject as you're asking the questions. This is very good. There's this question by Nelly Mumu. What causes bleeding clots during your periods? Is it normal, doctor, to bleed clots during one's periods?
Okay. So ideally, in our periods, we shouldn't have much by way of clots. If the clots are, if you are bleeding heavily, your body does not have time to regulate how heavy. Naturally, when you are bleeding, the body tends to try and stop that bleeding naturally. But if you are bleeding heavier than the body can manage, you'll find that you pass very big clots. It's worthwhile, especially if those clots are bigger than, say, about 2.5 centimeters to 3 centimeters in size. When you look at them on your pad, or when you see what has dropped down into the toilet, it's worthwhile to seek advice. So typically, it's the heaviness of the period that will cause more clotting. But
otherwise,
you also
if
want to be sure that it's not.
Yeah, go on.
It's not. It's a common thing, but you want to also be sure that it's not pregnancy related or miscarriage related. If it's something that happens every month, if it's small clots, I wouldn't worry too much. If they are very big, I'd seek attention.
Here's another interesting question, doctor. This question is coming from Brenda Sungani Kajoba. So her question to you is that, Doc, is it normal for a 30-year-old to start menopause? And what's the cause? What causes it to start early?
So menopause I cannot really say that Brenda, someone who is 30, has started menopause. Menopause is at that range of 45 to 55. What we are going to term that condition as premature ovarian failure, or what would tell you as a layman is premature menopause. But I would prefer that we leave the term menopause to where it belongs in the older folk. So when your ovaries have failed, there could be a number of things. It could have been due to medication, it could have been due to infections, it could have been due to limited ovarian reserve from the time you were young, a number of things. I would want to investigate further and see, is it at the brain level? Is it at the ovary level? Is it the uterus that has a problem? So that you have answers. Also, at this stage, when your ovarian system has shut down, as evidenced by lack of periods, you need hormone replacement, because the hormones that the ovaries produces do regulate our hearts, do regulate the strength of our bones. So in this age, you need hormone replacement. But the question would be, why has it stopped at this stage? Once we find out the cause, can it be reversed? Is it that it's hormones that are not balanced, or it is a permanent ovarian shutdown? If it is permanent, you must receive additional supplements. But seek us out, and we need answers.
Here's another question for you, Doctor. This one comes from Maureen Musonda Chafwa. So Maureen Musonda Chafwa is saying, what causes periods to start when you feel anxious or when you receive bad news?
Now, some people are very sensitive. I did mention that stress causes release of hormone cortisol, which may also in turn affect the hormones of the glands in the brain that regulate the periods. So I did also mention and encourage ourselves as women and our men folk to give support emotionally during difficult times, because your hormones will automatically fluctuate. Now, some people are so sensitive that any bad news, their hormone levels, cortisol levels go through the roof, and a few hours later or the following day, a period starts. So it is just for you now to learn to manage your stress. When you receive news, I'll say it in vernacular, usachoka mutima. Don't try and see how you can handle your stress in such a way, because it can be quite challenging if you receive news this time a period starts. Again, after 2 weeks, again another period. So see how you can manage your emotions and your stress. If you are unable to see how, you can always visit our therapists. They are very well versed in cognitive behavior therapy, where you have some sessions and see how you can manage your stress. You are going to see a visible change in the behavior of your cycle.
Another very interesting question, Doctor. This is from Monique Vanake. So Monique Vanake is saying, what could cause irregular menses in a 12-year-old girl? For instance, menses start every 2 weeks.
Okay, so Vanake, that young girl, her body is still adjusting. Really, the periods may be irregular, right up to almost age 18. The periods may be regular, but because she's bleeding every 2 weeks, let's supplement her. Let's make sure she's eating well in her diet so that she does not become anemic, she does not become weak because of the blood loss that she has, and she does not fall back in school. Let's give her all the support. She may even, if the period is a full period, Vanake hasn't mentioned if it's a heavy period, a normal period, or it's just spotting that may not disturb the young girl very much. But if it's a full-fledged period of normal 5 days every 2 weeks, then the young lady may be put on the family planning pill. Now, this causes a lot of anxiety with the mothers. Oh, her fertility will be affected. No, the fertility will not be affected. That family planning pill is not for family planning in this case. It's working for another function, and it will not affect the girl's fertility. Rather, it will teach her body that every 30 days or every 28 days you must bleed at this point. So these are some of the options. The other non-hormonal options is to give her some anti-inflammatory drugs, mefenamic acid or brufen, if she needs it at the extra period. She does have some hormonal imbalance, but that is mainly because of age. So you can seek us out at any point, Manake, so that we can work out what is good for the young lady so that she's not disturbed and stressed, because this is a new thing also for her.
I see. And you know, one of the topics I'd like you to probably, you know, discuss and I'm lobbying for the people who follow this page. There are issues that are pending that relate to contraceptives. And I'm hoping that, you know, we can make time and you can be available to come and address those.
I look forward to that.
Yes, so you've heard, guys, she's looking forward to it. So we should have Dr. Muyoni next time to come to us and talk about, you know, issues of contraceptives. Next question. What causes irregular periods and how can it go back to normal, doctor? This is Nalu. I can't, is it Ivy? Ivy Nalu.
It's Eve.
It's
so
Eve, right? It's Eve, right?
It's Eve. So Eve.
Oh, that's how they spell it nowadays.
Might be a shortcut for Yvonne.
So irregular. Yes, okay, Eve, yeah. Go on, doctor.
So it's the same thing. The irregular periods, it depends on the stage you are. At extremes of life, for example, in our 12-year-old young girls, and then for some of us older birds, we have irregular periods as well because we are slowly winding up with our reproductive life. And so you may have. So the question is, at which stage are you falling? So one common thing is hormonal imbalances. And these can be corrected, for example, with the pill, like I had explained for the younger girl. So the pill may be used and it may regulate your period. But one thing with hormonal imbalances is after a while, it tends to recur. So don't be anxious. Just know what is the cause after your doctors have investigated. Know how to manage yourself together with your doctors. And if it recurs, then we know what to do. But simple measures, weight loss, good healthy diet, enough fruit, vegetables, drinking enough water, all of these do help you regulate. You will see a difference. And then one other thing is, one common trigger that I want to caution, which will fall in the discussion which you have mentioned, Dr. Mujajati, is the rampant use of morning after pills. Now, morning after pills and other contraceptives, they do cause hormonal disturbances. So you want to look out and see. Even when I have started a family planning pill, if I don't like the effects, you are better off finishing the cycle and stopping after you have finished the packet. If you stop halfway or you use emergency pill every other day, you know, you will definitely create a hormonal imbalance. But in some women, without even using all of these, they do have irregular periods. So I hope that answers your question, Eve.
There's this very important question, doctor. This one is quite critical. It's from Grace Musa Sikombe. You know, in rural areas, kids miss school because of periods, and some innovative people have introduced washable pads. And her question is, are washable pads advisable?
Washable pads, there's no problem. As long as you wash them, hang them out to dry, they are cleansed of all the blood previously. They have no smell about them. You iron them when you are ready to use them. You can use them quite well. These are things that people used to use back in the day, even before pads and cotton wool were readily available. And they are environmentally friendly. So it's up to you. And it's quite an economic saving, because I'll tell you what, Doc, and I'm hoping something can be fixed about this. Somebody has to remove the tax from menstrual products, because these things are so expensive. You'll find for one cycle, just to have adequate, pads and things, you'll find the cost is about 46 kwacha, 60 kwacha, depending on the type of pads. Some, of course, are slightly cheaper, but they're so expensive. So at the end of the day, it would be nice to see tax removed from some of these, so that the price can come down, and women can have have more use. Would want to see maybe.
Is that your appeal to Bali?
I'm appealing. I'm appealing. I'm appealing, please. I think for the women, give us a break here. Yeah, okay. But washable pads are a good option.
Bali should look into removing tax from menstrual
products. Yes.
Sanitary pads, whether
tampons, tampons. Okay. Of late, there's another product that's coming up that's very popular with young women, is menstrual cups. Yes.
Menstrual cups. Cup. What's the story around the menstrual cup?
So a menstrual cup is inserted into the vagina and fits around the cervix, and it can hold up to about 30 to 50 mils. So if you have a menstrual cup, if you are starting, I would recommend that as you insert it, use a pad, so that you are able to gauge how frequently you are able to change this pad, how frequently you are going to fill. And the cup will even enable you to report accurately to your doctor that, doctor, today I've lost 100 mils of blood. Yesterday I lost 150, or whatever it is that you are losing, because it's a calibrated, small, flexible cup. Again, a great economic saving, but it requires you to be very hygienic so that you don't contaminate yourself. It's very important to maintain good menstrual hygiene, whatever you are using.
Right. Now, there's one question I have to allow. It's a bit outside the topic, but it's somewhat related, at least because you mentioned it as one of the causes for menstrual disorders. So somebody asked us this question, slightly out of the topic, but we will relate it because, like I mentioned, this is Jenny Abok. I hope I'm pronouncing your name properly, Jenny. Her question is, is there another way to manage PCOS? Polycystic ovarian syndrome. She says she has polycystic ovarian syndrome. What can she do? She says I stopped taking medicine, and also my hairs always fall. Yeah, so she experiences hair loss with whatever medicine she's on, and she's struggled with it. I don't know what drugs she's taking, and basically she's asking, is there another way of dealing with polycystic ovarian syndrome, which is PCOS?
Yeah, so PCOS, again, we had touched on earlier in the show, where we talked about an imbalance between the hormones or androgens, the male hormones, that may cause either excess hair. Polycystic ovarian syndrome also may cause glucose intolerance, or a problem with how you metabolize your sugar, affecting insulin balance. And it may also be in a complex interplay of other hormonal imbalance because she's experiencing hair loss. Now, frequently, hair loss also occurs in women with hormonal imbalance, particularly thyroid. So she may have a complex of issues. But first things first, with polycystic ovarian syndrome, you start with diet, start with exercise, exercise in your daily routine. Minimize salt to, reduce the feeling of water retention and bloating. Take a lot of antioxidants, aka lots of fruit and veg in your diet. And then it's difficult to say what kind of patient you are. If you are on the obese side, those will help you to control. If you are not on the obese side, also there are surgical options. One surgical option, for example, is ovarian drilling. This you want to discuss with your gynecologist, but it does improve. Other people also take a diabetic drug, which improves menstrual regularity, actually. All these hormones, they have an interplay one way or another. And so some taking metformin, for example, may help you balance your hormones in the long run. But polycystic ovarian syndrome can be a long-term, a lifetime condition that you have to deal with. So starting and stopping may leave you at a disadvantage, depending. But if you are stopping because of guidance that you are improving, but it does sound like you are tired of what you're going through, and I do empathize with you on what you are going through. But we need to come back to the drawing board, Jenny, and see what we can do about your polycystic ovarian syndrome. Don't lose hope. There's a lot that can be done, but you have to be patient.
Doc, this one is just a comment from Denise Bumba Kapapa. I can testify to the reduction of sugars, caffeine, and fizzy drinks. It has helped me a great deal. Once heard Dr. Mampwe, or is it Mampwe or Mampwe? I don't know, talk about it years ago, and I've never looked back. And yes, we need that tax on sanitary pads or sanitary towels gone. I think we need to start a campaign for this one.
We need to start a campaign like yesterday.
Directly to Bali's office. I think tonight what I'll probably do is that I'll create a post and we'll ask the women on this page to tag Bali until he sees it, that the women of this country want tax removed.
One tax removed.
Yeah.
I think it will improve our economic prospects for one, because we want to be productive. We are not going to sit around and wait that what can the government do for us. We want to be active, but for us to be active, we need good pads.
I hear you, Doctor. I hear you. On that note, Dr. Muyoni, I need you to quickly, give your final remarks to our audience on this topic. I know we've not touched everything. In the 1 hour that we had, we've not touched everything, but we've touched the essentials. And so for people that they have missed, and also appeal to the people on this page to share this video, because it needs to go as wide as possible. With shared information and knowledge, women tend to make informed choices, or families will make informed choices, and therefore seeking medical help sooner. So go ahead, Doc.
I want to emphasize to the women out there that look, we are here for you, and as healthcare workers, we are here to guide you on your menstrual disorders. We are here to help you understand your fertilities. We are here to support you so that you are more productive. And it's not a curse to have these menstrual cycles or menstrual disorders. It's just a question of understanding your situation and managing yourself in a better way. So don't shy away and feel it's womanhood and hence I have to suffer. No, we want you to be happy. We want you to optimize your productivity, and we look forward to seeing you in our centers. I'll appeal again that we look forward to better things for the women in terms of menstrual hygiene products. And I'm glad the men are tuning in to listen. The more you know, I mean, there's no mystery about it. These are biological processes, and there's no shame about it. You are a young man today, tomorrow you will be a father with a daughter. That the daughter will be able to ask you questions that you may answer. You may be a young man at school and your colleague may be struggling with heavy periods and passing out at college. You may be able to give her some information that will help her. So let's all take responsibility from each other, demystify the period, make it something that is not a shame or anything like that. It's just one of those things that us birds go through.
Right. Dr. Mune, I'd like to thank you most sincerely for joining us on this segment. And I hope that when we invite you next time, you will be able to make yourself available. Please thank your family for allowing us to talk to you.
Thank you so much for having me. Thank you so much for having me. Thank you.
Right, so there you have it, and would like to thank Ayo for making this possible, and would like to also appeal to you. Please click that share button. We need this information to go as wide as possible, and we need this information everywhere. So share this information, share this video, put it on your feed, whatever you do, whether it's on YouTube, anywhere. And should anybody miss this, ask them to subscribe to our YouTube channel. It's a lot easier to navigate our videos via YouTube. So you can subscribe to our YouTube channel and you should be able to get everything. So go ahead, do share this information, do share this video, let it go as wide as possible. We need everyone to have this information. That said, as we say good night, do take care for healthy and prosperous citizens. And here's a word from our partners, Ayo.
What can you do with 5 kwacha? Not a lot. A 5 kwacha Auto Boost can get you 1,900 kwacha extra Ayo cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I'm Punkena Moto. Kairi Hospital Church. It's a 5 problem. 296 cash. Vasanya kwa chat. Wamitumira kwa 2 pills. Kaira manda kusongera tukara mukurazichi yako datawole bomba. Alipira kwa nabana kuma school. Wale bombenchi tulisuma sana.
Dial *296# to auto boost and quickly grow your Ayo recharge with care cover each time you recharge. Ayo, together